Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome back to the LowCarbMD podcast. Tro, we have a real live doctor here.
I
Teach
know.
us stuff.
Finally, somebody more sensible than you and me.
A sensible doctor, a Midwest guy that's, cool guy. We met in Denver, actually. It was kind of cool. So it's good to have you on, Doc. Tro, do you want to do some of the big intro stuff?
Yeah,
this place
sure.
called Ohio State. I guess that's a school, right? Ohio State.
Yeah. So let's talk about it.
The Ohio State.
The Ohio State. Yeah, my whole family's Ohio State Buckeyes fans.
So this is Dr. Jim Ingram. He is a board certified family practitioner. He started his undergrad at Purdue. He did medical school at Ohio State. And he did his family medicine residency at Memorial Hospital. And he is a practicing physician, including physician leadership roles. But ultimately, he is here on his own accord, talking about his own life journey. And because we love to hear those stories about doctors kind of seeing the light and kind of changing things and taking to their health in their own hands. So, Doc, we're so happy to have you here. We've met before. And I know you said, Tro, as a condition of doing this, you said, Tro, you have to keep it PG. So I will keep it PG.
You're not allowed to have any tirades against other dietitians and all that. We're going to try to be nice.
Yeah, I really appreciate you guys having me on. And it's amazing how time has flown by since 2019 when we met in that conference in Denver. But I'm been terrified to do this for those 3 years. I think I've been ducking it, but I'm glad we're here today.
Yeah, so I think some of this is, it's just tough. I know, there's now more than ever, there's increased scrutiny on doctors, and we have to, it's a pandemic. We have to be careful what we say, and we have to be, very clear with our medical communication, but we're going to try to duck and avoid all that stuff. I just want to hear, okay, you're a family doc, you're through residency, in your career. Did anybody ever talk to you about nutrition? I mean, what was your experience with nutrition before this, you came to the light, I guess?
Well, that's a great question. I guess I would go back to my degree at Purdue was a physiology degree. So we studied the biochemistry. We followed the carbons around the Krebs cycle. We study metabolism of fat and protein and sugar, but nobody ever really put it together in terms of nutrition, in terms of how what we ate affected our health. And so I think when you go back to the 80s when I was in high school, and the 90s when I was in undergrad, and then going on to med school, we accepted this low-fat paradigm, and it was just what everyone taught and what everyone understood to be true. And so that was what we practiced. And so we learned that diabetes was a progressive disease. The quote is in 93, I think the New England Journal of Medicine said it's a progressive and curable disease. And the best scenario is tight metabolic control with management to slow down complications. And so we learned that it's all about patient control of appetite and exercising more and just controlling the fat. And so that's what I learned, and that's what I taught. But I think I didn't find success professionally, and I didn't find success personally.
So can you talk about personally, because, me and Brian have talked about, how we gained weight through residency and college and college residency, and then into our careers. And then we all kind of saw the light and started to see that, wait a second, we had our own personal health journey. Did you have a personal health journey? Did you find that your health kind of deteriorated, or, were you like me, a 350-pound doc telling his patients that we all have to lose weight?
My story was a little different. I started out pretty lean, graduating from high school. I'm just a short guy, 5'6". I was 145 pounds. So I was pretty lean. I participated in soccer, racquetball, weightlifting, taekwondo, just a variety of different things. And then, like a lot of folks, I went to college and didn't eat very good food, had a lot of pizza, nachos, and whatnot. I got through that experience, gaining a little bit of weight, but not a tremendous amount. And then in med school, again, we were drinking lots of pop to stay awake and trying to hit that low fat guideline. And so my wife is a fantastic cook, and she grew up in a home that was very conscious about diet because of her father. He had hypertension. He was a very disciplined guy, an engineer, and so they were very dedicated to low fat, low salt. And so that's what we did in our early life. I think, like a lot of middle-aged guys, I found that I gradually gained weight. I had less and less time for exercise as I got into my career and I got involved in church and other things. And so I gradually used food for joy and for celebration and lots of different things. I became maybe more affluent than when I grew up, and I had the ability to kind of splurge. And so the weight kind of slowly accumulated. And I think around 2012 or so, I started having some health problems that I didn't really recognize as being related to weight and insulin resistance. But looking back on it, I think they were.
And so what happened?
So randomly, out of nowhere, I started having shoulder pain. So left-sided shoulder pain. I had adhesive capsulitis. So I can't sleep at night. I've got pain. I've got stiffness. I'm having trouble getting my coat on and my shirt on. And I go to the physical therapist, and he says, "Hey, doc, do you think you might have diabetes?" And I said, no, why in the world are you saying that? And he's like, well, a lot of my patients have diabetes that have this problem. And inwardly, I'm thinking, well, you're way heavier than I am. Who are you to say this to me? And I kind of blew it off. I went through 3 months of PT, got better, and then went on with my life. Then I started noticing tiredness, fatigue, moodiness. And then I had right lower leg pain. This was maybe 6 months to 8 months later. And it turns out it was inflammation of my posterior tibialis tendon. And as I really thought about it, it was ironically, kind of embarrassingly, where my recliner supported my leg when I laid back in my recliner and goofed off at night. And so I went through another few months of therapy, got that better. And then the winter of 2015, I got a cold, and it was your typical upper respiratory tract infection. And I'm pretty committed to not using antibiotics unnecessarily. So I'm coughing my brains out, bringing up some purulent sputum. I get this chest pain. And it was in different spots in my ribs, and it was really weird. It was exactly where I'd injured myself water skiing a few years before. It was the exact same spot. And I told my wife, something weird is going on here. And we ended up getting a CAT scan looking for pulmonary emboli. Didn't have that, and got a little bit better. Checked myself for rheumatoid arthritis and lupus, all sorts of autoimmune things, and just couldn't find anything. But I found that inflammation continued, and I had inflammation at the base of my thumbs to the point that I couldn't carry my laptop around. I had to ask my nurse to carry that around in the office. Fortunately, she was scribing for me, and so I could just play it off, but I was really hurting. And then I got adhesive capsulitis in the opposite shoulder. And so I find myself back in the physical therapist's office. I've gained a little bit more weight, and he has too. And he's like, dude, you think you got prediabetes or diabetes? And it turned out that I didn't, but it was this wake-up call. I had to realize that the dietary advice I gave to my patients wasn't working. The dietary advice that I was following wasn't working personally. And it really put me on this path to go to the literature, question everything I've been told about nutrition, and try to really look at the primary literature and see where that support was. So I was kind of surprised what I ended up finding, and landed me in this community.
So I want to talk a little bit about this because they have done literally interventional trials comparing low carb to low fat diets. They've literally, for chronic pain, for knee osteoarthritis. So how do you go from, getting this diagnosis of adhesive capsulitis, getting this diagnosis of, osteoarthritis or whatever, or arthritic type pain, you're feeling this inflammation. How do you connect the dots? Because I don't think the interventional trials that I just mentioned that we have done, I think they were 2018 and 2019. They may not even been in the literature. So how do you start connecting dots, right? I mean, they don't really teach us to think creatively. So, right. They really, it's just like, if it's not choose wisely, they're not really educating us about it. And choose wisely is like a campaign to get doctors to order less stuff and think even less creatively. So,
well, I give that credit to my therapist. And so I went to the literature and did find that there was this association with adhesive capsulitis and insulin resistance. And so I knew that even though I didn't have the A1C elevation, I hadn't done a fasting insulin level, I didn't have those items of insulin resistance. I was overweight, at a BMI maybe 29, and I was hypertensive. And so I knew I was somewhere on this spectrum. And so then that made me think, well, I want to go to the cardiology guidelines and see, well, what is the support for the DASH diet? What is the support for low fat? And I kept finding there are guidelines with like circular references without randomized controlled trials of much quality or power. And so I would see, well, the DASH diet, maybe lower my blood pressure by 2 points. I thought, well, that's not what I'm interested in. I want to get healthy. I don't want to lower my pressure by a couple of points. And I looked at like the Mr. Fit trial, and I saw that multiple components of lifestyle intervention just wasn't all that helpful. And somewhere in there, I landed on Sarah Hallberg's YouTube video. And the title was Reversing Diabetes Starts with Ignoring the Guidelines. And it just blew my mind away. First, because I learned that day that you can reverse diabetes. I was never told this in any of my training. I hadn't seen this in my experience. This concept that you could reverse diabetes was just earth-shattering to me. And I had to realize that there was information I didn't know and understand. And right around that same time, Peter Attia had a video that kind of changed my life as well. And he was explaining this encounter with a patient in the hospital. So amputee, where he's talking to this guy, and the guy says, doc, I'm trying to eat healthy. You guys tell me to eat this way. I'm trying to monitor my sugars. I'm trying to use insulin appropriately, but it's not working. And secretly, kind of the cynical surgeon and the doctor, well, we just assume patient's not truthful. That they are the one that's the problem, not our advice. And he realized that that wasn't true, that maybe the advice we were giving is not workable advice or effective advice. And he just talked about the emotional impact to him when he realized that he was giving instructions that wasn't going to be effective. And that really hit my heart. And I thought, that's absolutely true, that I've been telling patients all along that you just need to be stronger, you need to cut your calories and exercise more. And quite frankly, in my diabetic visits, hadn't talked about nutrition or diet at all. And I really felt a conviction at that point that I got to find a better solution, a better direction for myself. So for myself, I did the obvious. I cut out the white chocolate mochas. I cut out the desserts. I went to the weight room. I did a little bit of cardio. And during that time, I had a lot of time on my hands. I started listening to podcasts, and I started hearing low carb keto in the endurance space and in the weight loss space, and then in the seizure control space. And I was really embarrassed that I had this experience in residency where my wife worked on a ketogenic diet clinic for pediatric seizures. And she saw life-changing results. And these little kids would have resolution of their seizures with a week in the hospital. A third of them resolution, no meds, a third significant improvement, and a third would be discharged without a lot of change. But I had been exposed to this life-changing intervention many years ago, and I just didn't realize that it had this power in the diabetes space and also the weight loss space.
So
I think that's really profound. I think, you know, some of this, I'm sorry, Troy, but West Coast can cut off people too. You know, it's really profound. I think part of the benefit all three of us has, we're struggling with health problems and weight and all this stuff, and we know we're following the guidelines, and so we know we're doing what we're supposed to do. And then at that point we had a responsibility. We couldn't keep blaming our patient for not being compliant, because that's, everyone said, they're just not listening. But when you have metabolically healthy doctors that have never struggled with weight, they think, well, everyone just needs to do what I'm doing and it works. And, you know, so there's so much judgment on the patient for failing, and also having to go to the guidelines to say, gosh, all these guidelines that we're following, what do we do if it's not working? We have, you know, it's as docs like to, as is abundantly clear, doctors like to follow guidelines, tell us what to do. Step A is this. We like these flow diagrams. And if this doesn't work, try this. If this doesn't work, try that. Not say, wait, none of this stuff's working. What do we do? You know, so I think that's great. And I have to ask you, how long were you practicing medicine at that point when you come to this realization?
That was probably 20 years into it.
Yeah.
So I had many, many years of experience of seeing diabetics. And if you think about 1990, I looked at the data. Indiana obesity was only 13%. And then over this 20 years, it's come up to 33%. So diabetes and obesity wasn't really that much of a concern in residency and in med school, but it's become a major part of our day. And it's just patient after patient after patient. And I had to realize that not talking about nutrition, leaving that to the dietitians wasn't effective. And the challenge is that we would see patients see the dietitian and receive this message that you can eat whatever you want. We're just going to cover that with medications. And then they would come back to me and I would find that, oh man, it's really hard to cover that with enough medications. And what we see is lack of success and patients gaining weight and doing poorly. And so I had to apologize to some people after a while, but I will confess I was pretty scared, because at the time I was learning about low carb and keto, Dr. Noakes was going through his problems and Dr. Fetke was going through his problems. So I told my wife, I'm going to do this on the lowdown. You know, I'm just going to focus on myself and get healthy. But patients would say, hey, doc, you've lost a ton of weight. You know, you got cancer. What's going on? And I'd have to say, well, no, you know, I'm doing this low carb thing. And then my partners were like, hey, you know, you've lost a bunch of weight and you've kept it off for a year now. What in the world is going on? And then I had a young lady come to my office and she said, hey, I think I'm going to go have cosmetic surgery. I've had a couple of babies. I got this extra belly fat. I'm going to go have this removed. And I said, well, have you thought about doing a low carb diet? Has that ever been suggested? And she said no, and she implemented that and lost all that weight. Well, little did I know, she had a position that her role was to promote health for our hospital. And so all of a sudden, I have this very energetic, charismatic young lady that was like, Dr. Ingram, you have to get this out to the community. And we have to spread this news. And And so she outed me. She made me become public. And so ever since, I've been trying to know the literature and be able to present it in a way that helps people understand what it is, and try to thread that needle. Let's not pursue controversy, but let's help people understand the information.
Can oh, it's my turn now, Brian. I get to go. Yes, as we say, beauty before age. So Jim, I'm just trying to understand this all. So you're a practicing doc, and you see some musculoskeletal issues that you think are related to inflammation. You go down a rabbit hole and think, wait a second, maybe this is related to a hormonal issue. And you find the low carb literature, find the kind of, but you're actually scared to talk about it, right? And rightfully so, because of Tim Noakes, because of his career was put on trial basically, and you're scared to talk about it because of Gary Fedke, who also basically almost lost his job, and eventually these people were all exonerated. But so you're kind of flying under the radar, and then you help this person who kind of pushes you to be more vocal about it, and you form a union, and you're learning the literature. How does your practice change at all in that time? As Tim Noakes gets exonerated, Gary Fedke gets exonerated, and has your practice changed? And have you, has your practice, your partners, do they come ask you questions? Are you sharing information with them? Or, did the practice of medicine change for you?
Oh, absolutely. So somewhere in there, I came across Nina Teicholz and her book, and read that in about a weekend, and learned all the studies that she quotes and supports to encourage us. And so I gradually started sharing information, and over time, I got to know Dr. Unwin's work and his work with the sugar infographics. And so now my approach with my patients is just to inquire, well, hey, do you understand dietary carbohydrates and what they do to your blood sugar? Have you ever thought about cutting those back? And has anyone told you can reverse your diabetes? And most patients really have never been told that they can reverse their diabetes and get off of medication. And so it's a challenge, because I have a general population. They're not self-selecting. So when I think about you and Brian, you're well known for low carb and keto. So you probably have some patients that are really looking for that information. But my patients are not necessarily that case. So I have to win them over. And I'm not as good as Dr. Unwin at it, but I do have enough successes that I can't stop. And so I know five people that have lost 100 pounds. I know several personal friends that just took a short conversation over a cup of coffee, and they lost 80 pounds. So they both happen to be pastors. They both describe, my life is stressful. I go into all these meetings. They expect me to be nice, and at all times I can't be angry. I can't be frustrated. And when they would have these stressful interactions, they would feel a compulsion to stop at someplace and get some sugar. And so we talked through these concepts, and I've been able to see them implement those things, have great success, and just follow them on Instagram, see they're out running because they feel well. They've lost 80 pounds and keep it off. And when you clinically have patients that implement these lifestyles and they get off of insulin, they reverse their diabetes, they come in and they say things like, I'm never going to change this. I can't believe it. My triglycerides went from 900 down to 90. My A1C went from 11.5 to 5.5. Doc, I'm never going to stop this. And so when you have that kind of success, it's a lot easier to want to work through some of those challenges that you see.
In your career, just before you kind of went, it sounds like we all found this rabbit hole: Gary Taubes, Nina Teicholz, Jason Fung, and Dr. Fedke, Dr. Noakes. How many times did you see kind of major disease reversal, whether it's diabetes, whether it's hypertension, whether it was massive weight loss? How many, did you see it frequently? And do you think you see it more frequently now, just anecdotally?
Well, that's a really interesting topic, because we really want to see diabetes reversal. We really want to see weight loss. But I've been really pleased to see that people have mood improvement. Sometimes they have a lot of GI improvement. Personally, I know off and on throughout the years, in times of stress, and I could have a lot of bloating, abdominal pain, those types of things. And personally, I've seen that just go away with a low carb diet, and have patients have said that as well. I can't say there are some more dramatic things that patients have experienced, like ulcerative colitis and Crohn's remission out there. I haven't personally seen something like that. I've seen more subtle things. The skin issues improve, the bloating and GI distress improve, energy. One of my colleagues is 65, and he just has boundless energy. He says, I'm never going to stop this because of the boundless energy and the decreased mind fog and the better thinking.
Yeah, how awesome is that? I think a lot of us took pressure early on, and so you weigh, okay, the cardiologist is going to think I'm nuts, and that's okay, but my patients are happy and they're doing better. I'm seeing improvement. And then, did you have to weather the storm a little bit at the beginning, or were people, because of your 20 years of experience, more receptive to you saying, hey, I'm doing something new?
Well, I think it's an ongoing discussion. So my partners that I worked with saw my improvement, and so I think they were pretty easy. They just thought, hey, he was pretty overweight, and now he's not overweight, and now I see him out running and doing triathlon, doing all these things. And so the folks who knew me the most were the easiest to sell. And so now, probably 6 years out, patients kind of come and go, and so it's been fun. Occasionally patients will come in and they'll say, hey, I haven't seen you in 6 years. You were really fat before. And I'm like, oh, I don't know how to take that. It's kind of I don't know, a cut down or something, but I guess it's a compliment too. And so it's encouraging. Just when I'm feeling like it's a real struggle, someone will stop me in the hall and they'll say, hey, thanks for talking to this person. They'll say, thanks for talking to Johnny. And internally, I'll be thinking, I don't remember who Johnny is. And then they'll say, well, Johnny's down 60 pounds and he's been able to stop a bunch of medicine. Thanks for changing his life. And that just gives me the fuel to keep going.
Yeah. And the hard thing was, I have to give Tro some credit on this part of it, but my frustration was I was in a practice like yours, and I'm telling everyone, I want to help everyone, but 80% of the people really didn't want to hear it. They weren't going to change what they're doing. So I was frustrated because I was taking time away from my wife and kids and family, working through lunch, working late at night for that 20% of people. Now we're kind of cheating the system and go, okay, if you're local, because a lot of people come to me because they're like, I'm sick of my doctor yelling at me every time I go in there saying I'm going to kill myself, even though their numbers are getting better and their blood pressure and they're coming off meds. And so, that's one of those things. It really does take a dedicated physician to continue pushing the message when a lot of people aren't even going to listen, or they're just hostage to you. Basically, they're not listening to the podcast like people here who want to make their health better, right?
Right, exactly. And so over time, I have to learn to be sensitive to who's going to implement these changes and who's not going to implement it, and sort out how can I help them? How can I help them understand? I think if everybody had my wife cooking for them, it would be easy. She's an amazing cook. She can make food in a keto way that tastes better than the non-keto way. And
I think I got you beat there. Jim, I got you beat there. I got to be honest with you. I definitely think I got you beat there. My wife is just on a whole nother, so maybe we got to get together and have them do a little.
But you guys both haven't tasted my wife's cooking either. So I think we're all pretty fortunate, right? To have that support at home. But that's really an important thing, that you can do it where you're not being tortured and you can enjoy good food, right? People don't realize that. They think of a diet as going to be like rice crackers, like I did, and a little bit of peanut butter on. That was your life, Melba toast and all that kind of stuff, right?
Yeah, and speaking of my wife, that may be an interesting thing for some patients. So my wife has been lean her entire life, and she has always been very, very lean and athletic. But her main challenge has been low sugar episodes. So going back to when I was in med school and she was in nursing school, there were times where just out of nowhere she would be confused and she would all of a sudden be kind of snippy and angry, which is a complete opposite of her personality. And we discovered their sugar was as low as 40 at times. And so throughout her adult life, she got into this pattern of just carrying food with her everywhere. And so she would always be eating something to keep her sugar up. And so I started down this path, started losing weight, started doing low carb. And she was a little bit skeptical about it for a while. It took me about a year to really adopt true ketosis. And after just not eating some of the stuff that she was making for me over and over and over and over, she adopted the diet herself and found that her hypoglycemia went completely away.
Here goes Tro's you're opening the door for Tro to brag. He's done case studies on this about resolving hypoglycemia.
Yeah, we've seen it. We've seen it honestly with the CGMs. That reactive hypoglycemia just goes away, right? And you get really resistant. I mean, there's such good studies with people who are fasting. You know, back in the 70s, you never get an IRB approved to do it, where they gave them insulin infusions and basically caused no, hypoglycemia. So we've known this for so long, and it's just
they cause hypoglycemia, but no effects from hypoglycemia.
Absolutely. And so my wife is a runner. She's a much better athlete than I am. And so one of the fun things that she has experienced is the ability to go run half marathons and not use any gels or any Gatorade or any of those products. And so where she used to be very dependent on this constant stream of glucose to just get around daily life and exercise, now we just run right through all the aid stations. It's just it's so much fun to just finish those races without any worry about carb fueling.
That's pretty amazing. Zach Bitter has a thing or two to say about that, I think.
Yeah, and that's been another kind of sub story for me, is that I've become healthier and healthier. I've been able to do more and more endurance training, and so I've run a bunch of half marathons. I did a marathon, and in May 2019, I was able to finish a half Ironman. And so all through that process, I had to have a variety of coaches there say, hey, Jim, we got to talk about your carb strategy. We got to talk about how you're going to fuel for these things. And I was like, dude, I got it. Don't worry about it. And it just has not been a worry for me at all on my 3-4 hour bike rides, long runs. I just go fasted, drink a little cold brew beforehand, and I feel great. And so it's so much fun to shoot a little picture and send that to my coach and say, dude, no problem. I'm a fat fueled machine, and ketones get me where I need to go.
I got to ask you a question here, because you strike me as a community oriented guy, somebody who likes to serve his community. Sounds like, you talk to a lot of different pastors and so, has this trickled into, besides your own medical practice, right? What about your family, your community, your community outreach efforts? Has any of this, epiphany, this change, this knowledge that you've gained, does it seep into other places?
Oh, absolutely. So my wife and I have been very involved in our church at different times, and that's probably part of the reason that I got overweight, is all these church activities, whether it's a men's group or a Bible study or a mission trip planning. They all have food, and it's all carb heavy, sugar heavy. So my wife is a great host. She's a great cook. People love to come to our house for these types of things because they know the food's going to be amazing. And so when the food is all low carb, it's pretty hard for them not to learn that message. And so I would say that those folks who spend any amount of time around us have adopted low carb strategies to one extent or another. And so some of them have really benefited in that process. And again, we're trying hard to spread the word, but not be annoying about it. But, people just know when they come to our house, they're not getting bread and pasta and desserts with sugar. But she's going to make a delicious sugar cream pie with xylitol and erythritol. It's going to be better than anything you get from any of the Amish ladies around here.
Yeah, that's one of the things you see, like people really like it. So I'd bring stuff like low carb to like Maria Emmerich, I'll bring her chocolate pudding, right? The hard boiled egg pudding, and people will eat all that and leave the other desserts. They like it. They non-low carb people are liking that, right? So that's one thing too. And one thing I wanted to step back to that is critically important. I want our listeners to really understand this. We were watching, like you said, Gary Fettke and Professor Noakes stand up, and we saw what they went through. I'm telling you, not only that, they were getting bullied behind the scenes. People were giving them death threats. It was horrible stuff that happened to these guys. And so during the midst of this, I reached out to Tro because I felt, I was one of those people. I saw the benefits and I knew those benefits. And I knew Fettke and Noakes were not going to risk their illustrious careers for something that's crazy where they're not making money off of. And so I reached out to Tro and I go, Tro, I think you're the guy, man. I think we should do a podcast talking about this because we have to change the standard of care. And the only way we can is to reach doctors like you or other docs out there who go, yeah, I'm kind of on the fence. Let me try it. Let me see what happens. If it doesn't work, you get rid of it, right? When it's working and you see the benefits. But I want people to know the absolute sacrifice, because if Fettke and Noakes would have walked away, they were offered, they say, we'll drop everything. Just walk away and shut up. You can do what you want in your clinic. Don't talk publicly. And the power of them standing up was what gave us the courage and you the courage and other people, because had they have lost, and this whole lifestyle would change, it would go away. And the ADA doesn't change their guidelines, and all these, we're seeing the benefits now of this lifestyle. Tro, go ahead, man. Jump in there.
Brian, I want to build on that, because one of the great things about Dr. Noakes and his trial was his assembly of Nina Teicholz and Karen Zinn and Zoe Harcum. And they really laid out the literature base in that process. And I followed that very closely. And so when my little hospital affiliated with a larger hospital system around here, some people did comment, Dr. Ingram is a CMO of this whole hospital, how are we going to handle this? And so one of the great things about this organization is the leaders are servant leaders, and they really live that out. And so when they heard about this, they came to my office, this office I'm speaking from, and they said, hey, tell me about this, what you're doing with low carb and keto. And I said, well, thank you so much. And wouldn't you like to be able to see this list of randomized controlled trials? And wouldn't it be helpful? Would you review this list of meta-analysis? Oh, by the way, did you know that the ADA says in their 2019 nutrition guidelines that reduction of carbohydrates has the most evidence-based to support improving glycemia and removing medications, and anyone that wants to achieve those outcomes should be offered this intervention. Would you review that for me? And so those folks were humble enough to say, yeah, thanks for providing that. And so even though there are some people in the organization, a very large organization, that are on the opposite end of the spectrum, the leaders now know that there's a good literature base. Dr. Ingram's not just creating these things, dreaming these things up, that I think they have confidence that if you want to sit down and talk about the literature, then we're ready to do that. We want to do that. And the other comment I'd have is I was a little nervous about this podcast and generating some criticism from our organization. So I report to one of the physicians that's very high up in the organization, maybe the highest authority physician. And I said, hey, what do you think about this podcast interview I'm going to do? And he said, it takes 17 years for something to become standard of care, but this is not quackery, and this is not fringe. This is mainstream. This is on our, when you go to the grocery and you see the magazines, this is a constant topic out there. And so he said, go and be polite and present your information, but, don't worry. And so I'm really blessed to have organizational leaders that are open-minded and want to do the right thing for the patients, and their expectation is just that I be polite about it and evidence-based, and so that's what I'm looking forward to, is more people to want to look at the literature and engage in what the literature says, because you guys have said many times before, practicing physicians are just so busy. Most of them don't have the margin in their life to come home and comb through all the detailed literature and really get into this as we have.
I want to talk a little bit about this, because it's great to have such a supportive leadership
environment. Yeah, for sure.
Environment, because most physicians don't have that, right? Jim, you've been practicing, clearly for a long time. The minute I met you, I was like, this is like the kind of doc that I would want to go to, somebody who's going to care about me from and somebody who's a community leader, in outside of medicine, and somebody that has, prizes family. And I'll tell you though, some of us young, whippersnappers, we don't get that kind of respect. In fact, we battle those things that you called, you mentioned quackery, right? When me and Brian said we're seeing a massive mental health impact 4 years ago or 3 years ago, and this is before the NIH trials that showed a ketogenic diet, can affect alcohol, desires for alcohol. This is before that. This is before we had those interventional trials that showed that interventional diets can improve mood, depression in adolescents and adults. We were saying, hey, wait a second, we're seeing huge impacts on mood and mental health. And we got threats, and I still get threatened to this day. This week on social media, I was threatened, to have somebody report me to the authorities, right? For things that are now well documented in the literature. So that I don't think people understand that there is still a very hostile environment out there, and you're lucky not to be in that hostile environment. I'll tell you that.
You're very kind in your comments, and I would say that I'm not without criticism. There is certainly, I encounter that occasionally. I'm trying to channel my inner Dr. Unwin and learn how to be more gracious and invite people to a discussion of the literature. And this low carb community has been really good about assembling what the literature base is, and it's surprisingly strong for low carb. There's just been so many trials to try to say low fat works better than low carb over the years, and it just doesn't hold true. And I've got studies going back to the 1770s about physicians reversing diabetes with carbohydrate restriction. And there are titles literally of when he eats bread, his urine is sweet. When he doesn't eat bread, his urine is not sweet. And it's just amazing to go back to that.
Let's see here. I'll do a show and tell. Can I get it? See all those old books right there, guys?
Awesome.
All those old books there. Those old books, like me, they're like, that's when I was Cheryl will say that's when I was in high school, those books came out, but those are from the 1700s, right? And they're talking about low carb. They go cut the carbs until they stop being sugar. And that's when you stop. That's what the diet they go on with diabetics. So then these people say it's crazy. So people would argue with me. I go, let's grab the old Osler book and we'll talk. Go grab it off your, and say, look, and I think the other thing in our defense, and for me, if I wasn't having, there's no way in heck I was gonna, stake my reputation and coming out and saying crazy stuff that I don't know is founded. But when I had 11 people come off insulin in 6 months, whenever someone criticizes me, I'll say, how many people have come off insulin in your practice with a low fat diet? How many have? None. Because I did it for 18 years and no one did. You just gave them more meds to get their sugars looking better. So why don't we treat the underlying cause? And so I think when people start thinking that way, it's different. And say, hey, you could talk to my page. That's why Fat Fiction was so powerful. They just went over 1 million downloads or something, or however many, I don't even know what it was. But it's the point of people see it and then they realize if it doesn't work, it goes away. If it works, it stays. Right.
Absolutely. And my dream is to where we move beyond these accusations that it's not sustainable, but where we develop resources where we help people to sustain it. Too many times patients will look out for information and they'll be told this is just not sustainable, but it's more unsustainable when we discourage people. We have lots of programs for all sorts of different dietary strategies, and this should just be another one that patients can choose and be successful in. And so that's my goal. And you're right, Tro, I'm kind of a middle-aged guy, so I want the rest of my career, I want it to be full of success. I want it to be meaningful and valuable. And so I know low carb is going to continue to be part of that.
That's so good to hear. It's good to hear solid docs who, you want to do the best thing for your patient. I when I first met you in Denver, I was thinking the same thing. I was like, this is a nice guy. He gets it. Like it's really when you want your patients and then have that joy. I see your eyes light up when you talk about your patients doing better and coming off meds and all that. That's how we feel. That's the cure to physician burnout, is to see your patients getting healthier, not sicker every time, and making more diagnosis codes. Taking them away is more fun, I think.
Absolutely. Joy in practice. And I think this has restored joy in practice for me that I didn't have for a long time. And one of my colleagues, that's what he would say, 65, and he sees an enormous amount of patients per day because he loves it. And every single one of them gets this low carb message because he just has so much fun reversing diabetes and seeing people regain their health through this strategy.
And it's so great. I mean, Troy, I know you feel the same way. I had a patient, and it's almost weird because they'll come in and they'll say, I have fatty liver disease, I have this, and depression and anxiety and all these things. And while they're saying, I'm smiling because I'm like, oh my gosh, this is great. Are you kidding me? This is great because we could fix this. Before I would go, oh my gosh, this person's a train wreck. And then go, oh my gosh, this is all reversible stuff. Cool. This is like when we go, oh, we're happy about it. And the patients look at me like, why are you happy I have all this stuff? I'm like, no, I'm happy because these are all treatable things that we could do together. Like, this is going to be awesome to see your improvement. Tro?
Look, you're preaching the choir. You're preaching absolutely everything you said, Brian, in terms of being this modality being a burnout stopper, right? Like a burnout stopper, and every part of this, I got to be honest with you, I cannot agree with you both. I got to lob you one question, both of you actually, Jim and Brian. I got one question for both of you. Okay, both you guys are a lot more wiser than I am. Both of you are a lot more experienced than I am. So there's a part of me, an idealistic part of me, okay, before we part ways, that wants to start thinking about getting these doctors that around the country who don't exactly, who are all somewhat independent, right? And getting them to start working together. And how do we get, practices like Brian, mine, and other practices to start actually working together, combining resources? We built out this app for our practice, Dr. Tro app. Okay, but we could call it whatever we want. Why does everybody need to do this? We could all start kind of working together. We're all collecting data remotely. How do we all start working together as a physician leader? Can you give me some guidance? How do we create a low carb group of GI docs, psychiatrists, internists, cardiologists? How do we, as somebody in medical leadership, tell me, what are we going to do to bring all these disparate parties that found low carb on their own? How are we going to bring them together?
Well, that's a very difficult question. And I think your podcast is really helpful because you connect many like-minded people throughout our nation and our world, and I've just so enjoyed learning who these people are, and then Twitter as well. And so Twitter has been such a fun thing for me. I've learned so much on Twitter because if I connect to Brian and Tro, well, then there are going to be other authorities that are connected as well. And so pop up in my feed will be a new study. And I tell my patients all the time, if you hear that keto is doing something terrible for you, you see some headline, let me know, because I'm sure someone's going to post about it and someone's going to have the right information. And if I don't have it, I'm going to email Tro or Brian. I know people who know people that will be able to give us the right answer. So please reach out. And so I think we all have to be networking. And the more that we network, the more that people are aware of the power of this intervention, the more they're going to be speaking up to their systems and speaking that, we need to support these patients better. And so I know if there are more folks like me in my health system, then the health system will invest in those resources to help those patients be successful. But there's limited resources, there's limited time and attention. And so we have to just spread the word organically and then ask for that support to be developed. And we're making progress where I'm working. I always want it to be faster than it is, but I'm so thankful that I have open-minded people in my organization that are willing to work with me. And so my goal is to try my best not to be offensive and to be encouraging and to find the right information so that people can come along in this journey and see the joy that I have.
Brian, I got to ask you, I know we usually ask them and all the listeners are like, stop talking, guys, and talk to the experts. Brian, how are we going to do this? How are we going to get
we've kind of become the experts over time, which is kind of cool, right? Because the reason is because we talked to all the experts and listened to them and said, okay, what are you doing? What works? What doesn't work? And we keep changing what we're doing to see what works. And I think, Tro, you're on the right page. I'm an old guy and I don't want to take over the world. So what I want to do is I want to take care of patients. That's my focus. I don't want to do research. That's not my thing. I don't want to argue like criteria and end values and all that kind of stuff. But what I want to do is see my patients be healthy and enjoy life and come back and say, yesterday I had the honor, I have a 76-year-old retired nurse who was on a low-fat diet all these time with out-of-control diabetes, all kinds of health problems. And I said, look, and she's looking at me like very skeptical. So we got her labs back. Her A1C is at 5.9. She started crying. I think it's been like 26 years since her A1C has been under the sixes, and she was up to like 9 before. But life stress and all this. But when you see that, you go, look at that, and look at your insulin cut in half, and look at this, and look at that. And it's like, wow, with minimal weight loss, really. But you go, look, you're so much healthier. Look at this. All right. Now let's start working out. Now she's like, I'm going to hit the gym now. Now she's ready to go and she's feeling good. Her inflammation's better. All this stuff's like, how much is that worth? So, Tro, to answer your question, I think you're on the right path. I think, right now I'm using the Restore app. What we all know is the limiting factor is the physician. There's not enough of us to help all the people we need to help. So we have to reach out to the dietitians. We have to reach out to the nutritionists and the health coaches and all that. And we have to be on the same page. We can't fight with each other. It's because all of us have a vested interest in that patient getting better. So if it's Tro who reaches the person, great. If it's me that reaches, or Jim, whoever that happens to be. So I happen to think what we need to do is have at least one person in every state who gets it, because I'm telling you, I know for Tro and I know people will travel. I have patients now that, I was at the conference, they're going to fly from Florida to see me. And I'm like, I'm in California. I can find someone closer. Like, we want you, and we'll fly out twice a year and we'll establish care, and then we'll do Zoom, and it's like, wow. Right. I mean, that tells you something, that they're sick of going to their doctor who doesn't get it, who's criticizing them and yelling at them or not treating them with respect. So there's a huge need right now. So what I see is that having a lot of independent doctors in different places, they use your app, they use Restore app, they use whatever to help educate the patient all along, because the doctor, I've tried it one-on-one and it's hard. It's a lot of work every week. It's a lot of time if you have a lot of patients. So being able to provide the education, or have staff like Tro does that, with health coaches and people who can really touch the patient, because it's not the critical thing we have to realize. It's not just about education. education is a part of this puzzle, but it's a lot of it is the support. Someone just texts you and say, hey, you're struggling. I see you're spiking your sugars every night at 8 o'clock. What's going on? Right? Let's talk about it. I'm going through it. Like one of my patients, he's been losing weight. I go, wow, you're really losing weight. He goes, yeah, I'm going through a divorce. Wow, that's not a good way. I can't take credit for that. That's not a good way to do it. But, you know, stress in life. I mean, that's what I mean. These guys who will argue with us because they study a rat in a lab and they think they know it all because the way the rat responded to different food ratios, not that the rat's going through a divorce and stress and they have a boss who yells at them all the time and they're in a miserable marriage. So I think that the answer we're really going to be able to impact health is if we can really provide that individualized care. And some people don't need to be on a ketogenic diet. Some people need food addiction counseling. Some people need someone just to hold their hand. Someone needs someone to say, let's do this. You got to jump on this, you know, and so we all are motivated differently. That's why there's so many different trainers that someone's are going to yell at you. People, I don't want to be yelled at. Just talk to me like a human being. Okay. And then you go to this trainer who's going to do that, you know, so I think we've seen this with the, you know, we have the Rob Sivas of the world, who's a real hardliner, right? And that's his thing. And that's going to work for a certain percentage of people. Then you have Dr. Unwin, right? And hopefully we can be in the middle somewhere and say, look, I'm here for you. Let's not give you excuses to fail, but you're not a bad person if you fail sometimes. Let's get back on the train and let's move forward. So I think it's going to be true that we have doctors all over the country who, you know, like I foresee that we'll have a Zoom meeting. So if I have a Zoom meeting with 12 people or 3,000 people, it's still a Zoom meeting and I can reach that many people, and all of us can do the same in our states because it's critical. I think it's we're at a critical crossroads in medicine right now, because the thing that's become abundantly clear in the last 2 years is the importance of metabolic health. I don't think there's any argument against that. I think I've talked to the world experts. I actually sat down with Peter McCullough for 4 hours and talked. I've sat down with some of these world experts and you go, what matters? Metabolic health. They're not metabolic health guys, but they see it. They go, here's who's dying. Boom, 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 boom. So we know the comorbidities are what we have to work on, because we have to be in the best shape we can to go through some of these things. There are some of them are inevitable. So sorry, Tro, for getting on the soapbox, but I think it's really critical that we see it that way, that we say, look, there's enough sick people for all of us to do well, and we have to be able to share the power, you know, with people and get good people everywhere. And you have one person in Texas, you know, I know Nadir Ali's in Texas, and I got someone great who's in Arkansas that I can say, oh my gosh, you have a great doctor right next to you. You don't need to come to me. Go see that great doctor over there. And then we support each other in that.
Yeah, I think we got to take it a step further. And that's something that when I've talked privately with you, Jim, I think really what's needed is good medical leadership to start, what do they call it? Herding the stray cats.
Yeah. Trying to get doctors, trying to get doctors together is like straying. It's like herding cats, right?
So I'm hoping that one day you can pass off your insight to me and help me, start to grow in ways that I think I need to. But I can't thank you so much, Jim, for coming and talking to us, Dr. Ingram. I know you had some reservations, but people need to hear wise people, not just us us rude Yankees.
Well, it's terrible here. We're not quacks anymore. Like the medical establishment is like, okay, there's not quack. It's mainstream. It's like, oh, now we got to find something else, Tro, to talk about.
No, let's keep it. I can't.
So boring, man.
More controversial. But thank you for coming, Jim.
Yeah. How about question and answers, by the way, Tro? Don't let the doctor get out without question and answers if there's any.
Yeah, it's been my pleasure. I'm happy to answer any questions if anyone has any.
Yeah. So, basically, we got another good doctor here, Dr. Horowitz. He says that we need to learn how to cook, and that, he does all the cooking for the family. And then we have Shelley Miller saying, that we are the 3 leaders in healthcare, and we need to take those next steps to create a nationwide group, Brian. So let's make it happen. We got to figure out a way to make that happen. And then, and they said, when will you get an insurance company under your wing? And I don't know. I want to stay away from I can.
No, there's some alternatives that I think it's the best team we could possibly have. Some of the there are definitely ways that where people can have a higher deductible insurance for if they get into a train wreck, and they can do direct primary care and save a ton of money and get the Cadillac of care, and they get callbacks, right? I mean, it is really, we can change the system.
In primary care, now we talk a lot about value-based purchasing and how all the insurers want to see a return on their investment, the employers. And my constant refrain is there's no more value than reversing disease. And so I keep pointing that out, that you if you reverse diabetes, you save so much money on those medications, and you improve their health, you improve their joy. There just really is no downside to that. And so that's my passion, is to try to get that information out there. That concept of remission, I think, is so new to people, and to try to find some terminology that doesn't scare them. That keto word is terrifying, but carbohydrate restriction is a concept that unifies a lot of dietary patterns, and it's really just another way to say don't eat processed food and eat real food. And so, man, I've been really honored to be able to spend some time with you guys today. I appreciate you reaching out to me, and I hope that we can get to know people better, and hope that we do get to share that meal. I would gladly love to see what your wives can do and see what my wife can do. That'd be a great day.
Yeah, awesome. That would be a bucket list thing too, Tro. Yeah, that's good.
Make it happen.
Good. Yeah, Doc. Thanks for joining us. And I know and really that says something about how doctors are scared to stand up and say stuff, like, because if you question the paradigm, you get in trouble. And trust me, we try to walk the line and try to say what's going to help the most people. Because ultimately for me, I did a lot of soul searching in the last year, and I had to say, my patient's health is what matters. The rest I can deal with. It's going to be a hassle, but as long as we have that dedication to our patients, go, look, I'm going to try to give you the best advice. I'm going to try to research and do my job as best I can. And some people may not like the answer I come up with, but that's going to be based on science and data and clinical experience. And I think that's something in medicine we really are going to have to step back to and say, do we trust our clinicians' clinical instincts? Right, not what the guy in the lab who's never seen a patient says it, but I think we have to, like the Dr. Unwins of the world, who knew what they were seeing and changed medicine because he stood up.
Absolutely.
And they said he was killing everyone. He was terrible. And they go, oh, his patients seem to still be alive and happy. What do you do? You know, the evidence is the fruit of our work.
Right.
Sorry, I said fruit. Tro gets triggered by fruit. Sorry, I'll use another expression next time, man.
I think we all made that oath, that Hippocratic oath, to do the best for our patient. It's not to follow the guidelines. It's not to follow authority. It's to do the best for our patients. And so that's my intention, is to go to my maker and have him say, you did a good job with what you do. Congratulations.
Amen to that.
Yep, absolutely.
Yeah, amen.
Amen to that.
Thank
so
you,
Jim, thank you so much, Doc. Thanks for joining us. It was a great time, conversation. We really appreciate you coming on.
You bet. Thank you. Have a great day.